All right, sounds good. Well, hi everyone. My name is Illyana. I am the community liaison for the Opioid Data Lab's drug checking program, and we're housed with UNC's Injury Prevention Research Center. So I will go ahead and get my screen pulled up. All right, does everyone see that?
Yes.
Okay, good. If you want, feel free. This QR code takes you to our website. We launched a couple months ago, so we've worked through some kinks, but on there you'll find blog posts, some research stuff that we have going on, all those different types of things, explanations about why overdose trends are going down and what that can mean, all different types of things. All right. So again, Opioid Data Lab. We're with UNC, but it's a multi-institutional collaboration with the University of Florida and Kentucky. And we believe that we are science and service. So we're at the end underneath lived experience because we're working with people who are living through substance use and other things. So why is this work important? The number one thing that we always say is because look at this, 42% adults have personally known someone who's died of an overdose. And this is a quick video just about some work that's being done with one of our counties who their EMS uses our services. So let's see if it's going to pull up. It usually does, but here we go. Let's see. Of course, this would happen, right? So, all right, it's not working. Usually it just starts to play on its own, but it's all right. It's basically just showing how one of our smaller counties here, they operate the drug checking services through their EMS. And that way they're able, obviously EMS is getting called to overdoses. And from there, they have built up trust within the community so they can take the substances and send them in to us to get them tested. From there, they've been able to connect, like, even if it's this certain bag of drugs has a logo on it, what is showing up within the bag that has that certain logo on it, so they can talk to the community about that and what to be on the lookout for, things like that. It also can help in regards to treatment and stuff like that at emergency rooms, seeing what's the patient may have taken, things like that, because it's not showing up maybe on their, urine drug screen or something like that. Our chemist is able to test for certain things that they're not doing at the hospital. And so, sorry, I'll try to send that link over afterwards so you can take a look at that. All right, so did it? Okay. So I'd say I'm having some issues here. Okay, this is just an example of two of our results that you can find on our website. It's all public, but there's a lot up there. But it's just showing a result from North Carolina versus one in New York and how they both came back with a mixture of 8 different substances. One was assumed to be heroin. As you can see, heroin's not even included in the list of what was found. In North Carolina, it was assumed to be fentanyl and xylazine, which was in there amongst other things as well. So what's going on in the drug supply? The first thing is counterfeits. So fake pills containing unregulated drugs. Example of this, if you aren't someone who has experiences with substance use or you work in this field of harm reduction, I'm pulling in some other things regarding food and things like that, but fish. Some people don't know this, but fish is mislabeled all the time. So especially white fish, it can be hard to, I guess, for them to figure out what is what, but how do you mislabel lobster? It still happens. So in the drug supply, things do get mislabeled, right? They're getting sold as other things. Adulterants, unexpected and harmful additions in street drugs. This one is a little dear to my heart. I love chocolate, but who knew that chocolate can contain lead and other things like that? Some people weren't sure of that. And you can just go to, I can get this chocolate from Trader Joe's, right? And so it's something you're used to going to the grocery store. You trust what you're putting in your bodies. You feel like if you're getting it from the grocery store, it can't be that bad. I mean, I know sweets in general, but overall, you're not thinking that it can contain certain harmful things. same things happen with drugs. Even if people understand the risk that they're taking doing certain substances, they're expecting to do that substance. They're not realizing that it's containing all these other things potentially. Potency. Unexpected fluctuations in potency drive overdose risk. So basically how strong something can be. I'm in North Carolina. I'm not sure where everyone on here is, but in North Carolina, you can only get liquor from the ABC store. You cannot get it from the grocery stores, Walmart, anywhere like that, the convenience store. It has to be this one store. But people started seeing Fireball popping up in grocery stores and they were confused, like, what's going on here? We're not supposed to have that. But what's the difference on these two bottles? One says whiskey, the other one doesn't. But just by glancing at it, they look exactly the same, right? But one's just more the liqueur, the flavoring, and then the other one is the actual liquor. But if you don't take the time to actually read the bottles and you just glance and you pick up things, it looks similar, right? So this is just an example. One is definitely much more stronger than the other one. The other one's like, maybe 0.05% just for flavoring, while the other one is the actual liquor. Similar things are happening in the drug supply, but they don't have this label that is listing every ingredient that's in their street drugs. So drug checking isn't new. It's been around since the 70s, the Woodstock days. I wasn't around, but I heard it was a time, to be alive and have fun, but they started drug checking. So what's the differences between drug checking then and what we're trying to do now? Drug checking has been around for festivals. Who typically attends festivals, right? A little bit more affluent, younger crowd, maybe, especially back in the 70s, tend to be more Caucasian, things like that. Now, drug checking, we're trying to make it more accessible to everyone, right? Where they're not having to pay for this service. This is something they're doing day to day, week by week, versus I'm just going out to this festival once a year to have a good time. These are people who are truly living this life daily who need access as well. So what is heroin anymore? This is just an example of across North Carolina, and we threw Myrtle Beach in there, North Carolina, and just within the same time frame, all of this was assumed to be heroin, and almost 3 different substances were they came back, right? That had all these different things in it, but it was just assumed to be heroin. So polysubstance exposure is common, even if it's unknown to the person who's using it. And I think, especially if you're involved in the treatment realm of things, listen to people and what they are saying to you, because I know there's a lot of stigma surrounding substance use and people who use drugs. But a lot of people do assume, hey, I've been using heroin for 15 years. I really, truly thought I got heroin, and they didn't know that it had a mixture of other things. So benefits of drug checking. FTIR and GCMS are necessary tools to expand our knowledge beyond test strips. So at our lab, we have the GCMS tool, which our chemists use. It's a mass spec, and that is able to tell her everything that's in there. In the FTIR machine, some community programs now are popping up, being able to have these machines. They have to get trained, but it can also tell them what's in it, and then they send it to our lab so she can confirm their findings, and also if she found something different as well. Studies have shown that drug checking encourages safer use practices. People can adjust their drug use behaviors by throwing away drugs and just overall make informed decisions. So I've met with people in the community who, does this mean that somebody is necessarily going to decide to stop using drugs? No. And that's their right. But they still have the knowledge. They see what they're putting in their bodies. And I have talked to people who have, decided, hey, I'll switch my dealer. I'll go to someone else. I will talk to somebody about this. Or, some people have decided to go into treatment because they've been afraid of what's going on in their drug supply. But again, this is all for the person to make these informed decisions for themselves. So 71% of what we receive are things that were consumed prior to submitting it to our lab, meaning they took the drug most likely and they got a sensation or reaction that they weren't used to, or it could have been involved in an overdose. Sometimes it's not, but again, someone can say, I've been using cocaine for this long, but the way I felt when I used cocaine this last time is unlike anything I've ever felt before. So I want to see what was going on here. And so they send it in. Of course, we do push for pre-consumption, but it's hard just because we're in North Carolina. People have to mail in their stuff to us, so it can take a little while. But either or, we accept it, and we are pushing for people to use this free service if it's available to them. All right, so like I've been discussing, street drugs change constantly. And in our lab on campus, we monitor street drugs as a public service. And this is just a little bit of our data. So the program began in 2022, but as of this month, we've almost analyzed 11,000 samples, which is huge. And I can tell you that our program has been growing rapidly. We probably did 5,000 within the last year. Like it's just dramatically increased, which is great. And we operate in about 40 states now. So hopefully, we could get all 50. You never know, but we are trying our best to reach as many people as we can. And so the different types of programs are health departments, clinics, hospitals, user unions, harm reduction programs, and EMS. They send us samples from around the country using this innovative kit. And innovative, my boss during COVID, he was doing a drive-in test and was like, the way this is made, I feel like we can do this for drug checking. So we created just this kit that gets sent out. It includes all the collection materials for people, and it has a vial of acetonitrile that they put the substance in. That way it is adhering to federal regulations, so we can ship the drugs, they can come across state lines and all of that. We made sure that we dotted our I's and crossed our T's. All right, so samples are given voluntarily. The tests are anonymous, and that is just an example of somebody swabbing a cooker and just putting it into the vial. And again, we don't ask for any identifying information of participants to protect them. Programs keep up with that on their ends. They all have different ways of doing that. A lot of programs have unique identifiers that they give out, things like that, because we do provide, which you'll see, a blue card for results where it has the QR code and the website. They can go on there and find their results, but also we do recognize that everyone doesn't have access to internet. Some people are transient. They may misplace a little tiny blue card. So it is good that programs have built up trust with their participants where they can hold on to whose number belongs to them, basically. So samples can be collected via scoop, residue, swab, pill fragment, or used cotton. And so we provide those instructions. We even have a video that people can watch. And we do have just the programs, the people who work there, they actually do the collection themselves. You can't just pass out the bags to the community and hope they ship it back to us, because again, we have to make sure we adhere by all those regulations and things like that. Programs share health information with us to give human context behind the molecules. So we've actually updated this card just to include even a little bit more. But we like to know what was the expected drug, if there were any different sensations, the colors, if it was involved in an overdose. Sometimes people know, sometimes they don't. But all of this is really good when looking at the data and looking at in your community what's going on in the drug supply. So packages arrive on campus in compliance with drug and postal laws. We have to use FedEx, but we make sure when people work with us, we send them all of that packaging. So you literally do not have to worry about anything but putting the sample in there and dropping it off at a local FedEx and shipping it back. We record the information and catalog samples. In the tie-dye is our lovely chemist, Erin, and beside her is Mary Alice. She was our program manager who helped get the program up and running. She is now retired, but thanks to her and Erin, who has literally analyzed every sample on her own up until we recently got another chemist. So big thanks to both of them because it's a lot of work. We prep the samples and load them in a GCMS. We interpret the high resolution results to determine exactly what's in the sample. And when I say we, I mean Erin. And since then, we've detected a lot of different substances. So far, she's detected 396 different substances. So that number is just growing, and we make our data public daily. So when we find new substances, we partner with UNC colleagues in pharmacology, animal behavior, and chem informatics. And it's really when they find those substances that is puzzling, they haven't really heard much about it. So they're able to partner with our labs and other labs too to figure out what is this substance that they're finding. But most importantly, we provide timely results back to the individual. And that's an example of the blue card. And each card will have like a 6-digit number that's unique to someone's sample. This is what it looks like when someone goes on our website, the entire results page. It will have that spectra that people can look at. And if you're really into reading that and figure that out, we have information on that. And our chemist is good at getting back with people and helping them. But it will have the location and the date. And when we say location, it will have the city or the county, things like that. We will never put exactly where it came from. And for those super small counties who are worried, we also take that part out. We make it a little bit more general to protect them in case you never know, some places aren't as open to the idea of drug checking. It will tell you what she found, if there were any trace amounts, which is the smaller amounts, new drugs that came up in the sample, all different types of things, and how to get help locally. So our information empowers people to answer questions of local relevance. So we like to say we love to hear back from the community, the findings of some of this stuff, but we don't always get that. And we've had to just tell them it's okay, but a lot of people do like to share with us, and that's great. We've answered way more questions than these, but these are just some of them. Again, like what's causing a patient's atypical withdrawal because they can't figure out what's going on. Can xylazine explain skin wounds? How accurate are our test strips? So sometimes people kind of make their own little studies and they're trying to figure out their findings and they'll send it to us to compare it to. Can black lights identify xylazine and fentanyl? Different types of things. We've had sex workers out in Western NC be able to come up with a list of people who were providing them with substances other than what they thought they were, all types of things. So they've done work with preventing amputations, so solving medical mysteries. And again, a lot of this stuff can be found on our website. Answering the community questions, synthesizing complex information, but most importantly, autonomy. We help people make better decisions about what to put in their bodies. And so again, our program, male-based drug checking lab, acetonitrile makes it federal law compliant. Turnaround week is about 1 week. It really just depends on, again, how far someone is from our lab. We get samples from California and Washington State, and we're all the way here in North Carolina. So it can take a week to get to us. So we make sure that people also are just very open with their participants about that part of it. Our services is free to North Carolina as long as it's not confirmatory testing due to funding from the General Assembly, but it's also very low cost to harm reduction programs and user unions. So this is just a little snippet of our terms and conditions because we like to make sure that our work is rooted in harm reduction principles. So making sure there's a timely way to get results back to participants. We do not provide services to anyone working with law enforcement. And also our services cannot be used to deny treatment or penalize patients for the findings. Again, this is for the individuals, yes, for the community to see what's going on, but we do not want our lab being used to hurt anyone in any way. So this is just something we received back from a clinical provider in Raleigh. Our patients feel valued because of this service. An entire lab was set up to help people who use drugs understand what they are ingesting and to not die. And it's showing people that they matter. This is just another example of a mixture of 16 substances that has been found in a sample in Asheboro, North Carolina. So it's a lot going on here. Of course, our findings have shown that powder forms of street stimulants have twice as many substances as the crystal forms. On our website, we have a watch list of certain substances that have popped up that, are making our eyebrows raise. It's something newer, or maybe it wasn't in certain areas, but now it's popping up all over. So if you want, you can look through that. We have great explanations of different ones. Another key thing that has also come out of this is science validates community experience. And so what I mean by that is the summer of 2020, something unexpected was happening in the drug supply. And someone from a local harm reduction agency was the first person to identify the xylazine. And they were linking it to the skin wounds that were popping up with individuals. So if you all don't know what xylazine it is basically animal tranquilizer. It's used by veterinarians, but it's been showing up. It's pretty much all over the US now in the drug supply. And early detection, again, the community, they had some predictions, like they were saying, it sure feels like an opioid, but the withdrawal is different than fentanyl. We think it's causing skin wounds. Men and women react differently. The sleepiness returns after 45 minutes. And so this is just to show within a lot of studies that started to happen with xylazine, it was found that it was a kappa opioid. So just like the community was feeling like, hey, it feels kind of similar, even though it's different. There are marked sex differences in response to xylazine. And again, I can link these papers and things like that to read more, but it's just basically going to show, listen to the individuals who have the lived experience. I know being providers and things like that, we have certain knowledge, but also the people who are actually living this life every day, they do as well, and they can actually teach us some things. So it is good to just have an open mind and listen to people. Again, this is just about some of the health harms of xylazine, just to follow up with that, the skin wounds, the withdrawal. People weren't sure if you should still use Narcan, but you definitely should. People, they're not going to regain consciousness as quickly because it's a tranquilizer. It can take, 45 minutes or so, but they still need that to help the breaths be restored. So it's important that people do spread that. People can feel like it's not effective if they don't see, someone pop back really quickly, but it just takes a little longer. So we have all this information. Now what? All right, again, being from the South, even though I don't really love this, but a lot of people do, it's sweet tea. So people like their sweet tea in different ways. And if I showed you all this table that just has a bunch of sugar on it, how do you know which sugar you would like for your sweet tea? It's kind of hard to decide, right? And so then if I did this, some people may know, but some people are still looking at that like, okay, I mean, I know I've heard sucrose, but what exactly is that, right? There's some people who will feel that way. So then if we did this, okay, people are able to pick out, this is the sugar that I actually like and I prefer to use that. So this is the idea of a safer supply. But we know with street drugs, it's impossible to completely do that. But with drug checking, we're able to get that information back to the community a little bit better. So, all right. Googling chemical names can give you wrong information. Like we know that. Like it can give you some right stuff, but overall it may not be completely accurate. And we have come up with a Chem dictionary also that is linked on our site to help people, where it's 5 words or less to retain attention. Everyone doesn't have a chemical background. I don't. I always tell people social science, not science, big difference. So give me the simple version so I can also take that back to the community. But we came up with this. So for example, rare but potent opioid. Okay, that helps out people, especially people on the street. They don't need to know the big scientific background all the time. They just need to know, all right, how do I pronounce this? Because that also disconnects people if they're unable to even pronounce what the word is. So we're providing that. And also, what is normal? People want to know, like, all right, I understand, but is it just my drugs or other people seeing this? How common is this? So we also are making sure that we're trying to provide that depending on the substances. And these are examples of a few drug alerts from across, right? Yemen, England, Australia, and Florida. One thing they all have in common, they're so wordy. Most people don't want to take the time to read that. Of course, if you have a strong interest, you will, but most people are looking at that and they're going to bypass it. It's too much words on the paper. Colors off, there's a lot going on there. So we did a randomized message trial across 6 or 7 different states where we interviewed over 600 people from each one of these harm reduction agencies using the standard drug alert and the optimized one, and just seeing which one did they prefer, which one they would actually read, what catches their eye, things like that. And we partnered with UNC advertisement media to help come up with these types of alerts. And from there, some of the big things that we focused on is making that the graphics are simple, nothing too big to distract people, make it of local relevance, urgency, a call to action, links to more information, because of course, all the information that's provided on those long alerts, that is important, but everyone isn't going to read them. So give them the option to click to read more, making sure you can still just get out the most important information on a smaller alert. Also making it to where it fits social media. We know social media is the thing now, so it has to be able to look nice on a social media screen. And of course, the hierarchy of information, carrying naloxone, the motivation to save lives, things like that. The key is the right message to the right person at the right time. Make sure they're short and actionable and relevant. And this is just something that we have up in our office, is drug checking doesn't solve the problem. It only gives us context for why people are dying. This is why this work is important to us. And this is just our funders. Just, of course, the views in our presentation does not reflect them, but we are so thankful to all of our generous funders. And a thanks to and from our team. And that is that QR code again. If you want to look at our website, I can, let's see, I can just pull it up really quickly. There we go. All right. And so, yeah, this is just what it looks like. Opioid Data Lab. I do put out a monthly newsletter, so you're welcome to check that out. Some are longer than others, getting better at that. We just started in September of last year, so working out some kinks, but the newsletters, I'll just do a quick little show you. It just talks about our service updates, anything related to our services, this peak OD phenotypes, that's something that came out earlier last month. Dr. Nab, he put something together. It's really interesting. So if you're interested in overdose work and things like that, I would say check it out. But we also post like opportunities for impact, just not things related to our services, but harm reduction in general. So if there's webinars or if people are hiring for harm reduction positions, things like that. We do all of that. Certain research studies or things that popped up, we'll post about that and let people know. People come and visit our lab. We talk about that. Our team members also write things. This is about helping out with donations in LA. We've done stuff about Western NC in regards to just helping out in harm reduction, things like that. And we also feature boxes of the month. People like to send us notes or draw on the return boxes. And so they're nice. We decided to feature them. But again, you can just look around there. It has that watch list that I talked about that has certain things that we're focusing on right now. So xylazine, B-Temps was something that popped up last summer that was very puzzling, and a lot of work behind scenes went into figuring out what was going on. And they still don't know why it's popping up in the drug supply. A lot of people have different, views on that. And of course, we have articles about the overdoses and things like that goes into some of this stuff. But again, you can like click on the different links and read up about them if you are interested. So yeah, that is our site. That is drug checking. So any questions about what we do or drug checking in general?
Thank you so much, Liana. That was such a wonderful presentation. I feel like I learned so much.
Thank you.
You guys are doing such great work. Oh, it's just so heartwarming. Um, yeah, I just wanted to open it up. There's no questions yet in the chat, but does anyone have any questions for Liana as we get started with our Q&A?
You mentioned in the beginning that you might talk a little bit about the trends, like the overdose trends.
Oh,
To hear about that.
so let me pull it back up. And so with that, there it is. So yes, I remember I mentioned that on our site, there's this, if I can pull it up. Let's see. Topics, there we go. Dr. Nab, he's been doing a lot with the overdose trends, and he was on NPR and he discussed some of it a lot. I will be honest and say that I don't feel like I'm the most knowledgeable in the area as to why they feel like the overdoses are dropping. But he goes into it on our site, and I can send you the link if you are interested in reading a little bit more about it. I will say some of the reads can be a little longer than others, but you can skip around on there. He has a timeline of things and how it is interrelation with COVID, so you can look into that. They even have it by certain types of substances, things like that. You can go into some more of the historical information. And then let me go to the next one. He has, yes, it's the Smart Overdoses Down and Why. It's a really good read. And it even has a link to the NPR, and NPR goes over like a very quick, it's much quicker than reading the blog post if you don't have time, just to see kind of what's going on there.
Thank you so much.
Of course. And if anyone is interested in drug checking, or if you know of harm reduction places in your area or clinics, who work with people who use substances, you think they may be interested or it can help their work, just feel free to reach out and we can just meet really quick. It doesn't take long to just kind of go over how to get started with our program. It's not a lot to it. It's really just signing the terms and conditions and figuring out the pricing or how things would work, the logistics, but people reach out to us and they can get kits within the week. So it's really a quick process.
Anyone else have any questions? I do. Okay. When you're going through your website, it does seem like y'all do a very intentional, good job at taking your science and putting it out to the community in a way that a wide variety of people can learn about the science. And how do you guys work on that? How do you do that? Because I feel like that's really hard for us sometimes as scientists. We want to disseminate our research back to the communities in which we serve. But sometimes it's just hard making that transition. So how do you guys operationalize that with your group?
So honestly, Dr. Nab decided, hey, I think we should do a newsletter. I feel like there's a lot of information that we have and it's just hard to reach people. And let's figure this out. So we just started looking into different like hosting sites. And then we decided, well, maybe we should just redo our entire website, because our website used to just be on the results page and it just wasn't the best. And so we were like, yeah, maybe we should make this a little bit more engaging for people. And honestly, since then, it started with the first newsletter, where if you look on there, we have a reading room section where we link a lot of different like scientific literature, not just work that's done at our lab, but other labs. And what happens is Dr. Nab or other people on the team who are just really interested in this work, they send me things. And so I just put it together and link it on the page. And as a group, we discuss if there's some paper or something that we feel like is super important. Well, all of them are important, but that we want to feature. And so we'll do that. But when it comes to like the stuff that Dr. Nab is doing, where he has the very long posts, it's just he feels like, again, whatever you feel like is so important to the community, we need to make this a separate post in itself and not just on the newsletter, so we can send that out to people. And it's honestly just getting started with that, because when we first started, we may have had like 100 people sign up for the newsletter, and that was just through sending out something to the programs that work with us. But again, that was September, and as of this month, we have like 1,100 subscribers. So it starts to grow, and each month I'm able to see, like, after each newsletter goes out, people send it out to other people, because after every newsletter or a post that Dr. Nab makes about his research, our numbers grow. So it is really through just starting out and being okay if in the beginning, again, it's not that many people. Watch it grow, because each month it would just go up slowly and slowly. And we were just so shocked that we're already over 1,000 people. We're like, okay, so people are reading this. And also leaving room for feedback, because I do encourage people, if there's something with the newsletter that, you see a mistake or anything you want to include, just email me. And so people have caught a typo that I may have put in there, and I'm like, oh, okay, thanks. Or people send us, hey, this is going on in our area. Can you put it in the newsletter? So I think us opening it up to other people and it not just being only our lab's work, that has helped too, to make it feel more inclusive. We even have invited other people to write things. So we have a way where they don't have access to the whole site, but someone can be a contributor through the Ghost platform is what we use. And they can just only work on whatever it is they're working on, but they still can't publish it unless we, go in and look at it and then publish it for them on our site. So that is something too. So the work doesn't always have to be on you guys. If you do want to reach out to other people, I think that's important. But honestly, yes. So long story short, the newsletter platform has definitely helped us get that information out to the community.
I have a follow-up question to that. So is your website then, it's not within UNC. You have your own website that's outside of that. That's
Mhm.
really important. Like, because I'm on a perinatal access program, but our website is within our university, which
Mhm.
makes it really hard to do some of the things that you're talking about, because you have to go through a lot of strange
Mhm.
approvals. I mean, not strange,
Yeah.
they're
Oh,
numbered, but it sounds like you have found a way to host yours outside of that.
Yes, because we have our standard like opioid data lab that's on UNC's website talking about who we are,
Yeah.
but we got approval to just have our own website that we just operate ourselves and not the university. So even though we're with UNC, we don't technically have the logo on there, like all that extra stuff, but we still got approval that it's okay. And since it's not housed through the university, we kind of write whatever we want on there. So that helps for sure.
Thank you so much for sharing. I feel like that's really inspiring to I don't know about anyone else, but I feel like that's something that I feel like my institute and my lab have been wanting to get better at. And so just seeing an example, just a really successful example that you just described, and seeing you now learning that you are the one behind the scenes of my question, actually, is really great to see. So thank you for that motivation.
Yeah, and
Um,
I think just having somebody to be the person that's kind of over it. Again, I don't do it all myself. My team sends me different things, but I organize it and make it look good for the website. But I don't just come up with everything myself for sure.
Yeah, a question I have, and if I'm not sure if you know the answer, but your funding, I mean, it's such a great project, and you said your funding currently through General Assembly, and I was just curious what if that is funding that's going to continue. What are your plans going forward? I think work like this is so important, and I really like what you said about the purpose of this the purpose that you have in your mission statement, but sometimes funding streams are different in their priorities.
Mhm.
I was curious how your group has talked about sustainability going forward.
And so one thing we do joke about is Dr. Knapp is really good at like finding ways to help our work go forward. But we have multiple funders. That is one thing that I've talked to him about it, and he felt like it was important. And especially with, the climate of how things are going right now, the fact that we have multiple people. And so some is more private funding, like we have the funding through Vital Strategies. We have the FORA funding. Our General Assembly funds us. We've had different studies. I just lost the name of it right now, but where they fund us. And so sometimes, for example, I will tell you Vital Strategies, our work is funded, and it's about making sure that we're bringing on different BIPOC communities and programs and stuff too, than just, the usual type of programs that have access to this type of work and things like that. But we got funding from them to help us support expanding our work. And so it depends on who it comes from. The General Assembly, they fund our work for the North Carolina programs, which has been very beneficial. So we're able to provide it for free in that aspect. But we also lay out what our views are, and we make sure that we hold still to them, that this is just how we have outlined our program. So we are not going to have our services be used to penalize individuals. And that's something we're just going to hold strong to. So if it is a potential funder that doesn't agree, then we would have to, if we can't work something out, then we would have to go somewhere else, because we want to make sure that we are protecting the principles of harm reduction. And so even when individuals do come to work with us, even if it's someone who is going to be a paying site, they still have to adhere to our terms and conditions and, our guiding principles, honestly. So that has been key. But again, I think looking for multiple streams of funders, I think that's been really big too. So when there has been a case where, maybe this funding is going to end and we're not sure that it'll be able to continue, we do have other funding sources in the meantime.
Yeah, that's also quite inspiring. I love how you're sticking with your mission, right? And having consistency with that. I think that's also something that a lot of us tackle with, especially in a funding environment that's uncertain, is sticking true to what your mission is and your goals.
Yes, and we're open that we do certain research things as well. Like we get funding from FDA and all of that. And so of course they like for us to do things. So we're very open about that. But with our work, technically, we're not using human subjects, because again, we are using the substances, and then we don't take any identifying information from participants. So that also helps too with that area.
Good point.
Which we know everyone can't do that part, right? The complete anonymous part of our program definitely helps us kind of get by with certain things.
Good point. What other questions do people have? Oh, Mel, go for it.
Hey there. Hello. I just want to give a shout out. I live in North Carolina, and I'm fangirling, right? I follow your blog. I'm on LinkedIn to get the updates, like all the ways I know what you all are doing, and like yeah, the power of what you all have done, and the teamwork that you have prioritized to make it happen. Like, I also want to give a shout out to everyone who is not in North Carolina. I think the other thing that has been so huge, like your team has personal relationships with the harm reductionists across the state, right? Like, as opposed to, right, what everyone often does for all the reasons that we do, that we focus on the provider side of substance use disorders and things like that. I think the switch of the paradigm has been so huge. And so just a shout out that you haven't, I don't think you called that out. And I think it's important for us to highlight your approach has been key to success, and the community trust, at least in Western North Carolina. I can't speak for all the state, but in Western North Carolina is huge. So thank you for all of that.
No, thank you. Yes, and that's so important. And since I've joined the team, I have gotten to meet so many people, and like you said, across North Carolina and honestly across the country. I've gone to different things, and someone has approached me because they saw my badge and they've been like, "Oh, I know Colin or I know Nab." And then I've been able to talk to them because again, they've been really adamant about forming those relationships. And again, Nab and Colin, they've been doing this work for a very long time, but they're really good at, they brought me into the fold and introduced me to a lot of people. So I've been able to form my own relationships too. And I think, like you said, also, we don't just work with, the providers. We're working with, everyone. We get substances from those samples from so many different types of organizations. So from hospitals to user unions and the clinics, or someone who started something out of the trunk of their car and it's their, so that has definitely helped.
Well, Ileana, thank you so much for coming. We really appreciate your time and sharing your expertise with us. And so, yeah, I just want to say a big thank you as we end here.
Of course, of course. And is it Camilla? Is that your name, Camilla? I'm going to get Nab to send me a summary over to you about that.
Yeah,
So
sure. Do you want me to put my email in the chat? Would that be
yeah,
helpful? Okay.
yes, thank you.
Yeah, I'm in Indiana and I work with people who use drugs, so I would love to see what I'm sure we have a lot of harm reduction here, so they probably already connected with you, but would love to see if some of the people I work with could. We have a few different programs that I think could benefit from this.
Oh yeah, for sure. And yeah, I can look into that too because I'm able to see who we have worked with and everything. So I think that would be cool, especially if they haven't been connected with our lab.
Wonderful. Well, thank you so much, Ileana, and thank you everyone for coming to our March Journal Club. And we'll see everyone at the end of the month for our next Journal Club. Thank you.
Nice meeting everyone.